Hi, I'm Dr. Frank Lista, and we're filming here in operating room number 1 here at the Plastic Surgery Clinic. Lots of my patients, when they come to see me, they say, I hear that implants can be smooth or they can be textured. What's the difference? Well, an implant surface is either smooth or rough, like Velcro, textured. Let me show you a couple. So this implant has a textured surface, and if you see, it's rough, like Velcro. And this implant is smooth. Now, implants are textured for a reason. If we use a teardrop shape implant, then the implant needs to be textured to keep the implant in the right position. If we use a round implant, it can be textured or it can be smooth. So implants are textured to help keep the implant in position, which is important if it's teardrop shaped, but not so important if it's round. The other thing, though, is that texturization was invented to help reduce a risk called capsular contracture. Capsular contracture is a complication where the body forms scar tissue around the implant and makes the breast feel hard. It's not actually the breast that goes hard, and it's not the implant that goes hard. It's scar tissue around the implant that goes hard. That's called capsular contracture. Well, what we've discovered is that texturization reduces the risk of capsular contracture, but only when the implant's placed above the muscle. If the implant's placed above the muscle, we think texturization lowers the risk of capsular contracture. But when we go behind the muscle, studies have shown that you can use round, you can use textured, or smooth or textured. Doesn't make any difference. The rate of capsular contracture is the same. So if the rate of capsular contracture is the same, we're going to use the one that has the lower complication rate, and that's smooth. So generally, behind the muscle, we use a smooth implant, and above the muscle, we use a textured implant to keep the rate of capsular contracture low. And that decision as to whether you should be above the muscle or behind the muscle depends on what's right for you. Some people think that all implants should be placed above the muscle. Other people think that that's not right. The answer is that these implants have been invented just for that use, and we'll use the implant that's right for you in that situation. Thanks for watching.